Today I am going to tell you something about infantile colic. Infantile colic means excessive episodes of crying in an otherwise healthy baby. And in fact, this is one of the most common reasons that parents bring their child to the emergency OPD. And most of the time it causes lots of distress to the parents because the baby becomes very fussy. Generally, this infantile colic is usually seen during the late evenings, night and midnight. So, typical episode of colic is like baby's face becomes very red, the hands and legs becomes very stiff, and then the tummy becomes very tight. This is a typical posture of a baby who is having colic. Most of the times this colic is in fact self-limiting, but it's always important to look for any other causes why exactly the baby is actually crying. It's important to know if the baby is having any fever, is the baby actually feeding well, baby might be having some ear pain, we should look for any abnormal movements. And generally in infantile colic, the baby needs to be comforted. We can try actually swaddling the baby, swinging smoothly, and putting some pleasant music or taking the baby onto the mother's breast. When we really need to worry about colic is when the baby is actually turning completely blue or completely white, or the baby is having any abnormal movements, something like fits, baby is having respiratory difficulty, because there can be some underlying serious causes which we might think of colic, but otherwise 95% of the times colic is actually very benign. Less than 5% of the causes will have any organic causes. And many a times mothers keep feeling bad that their diet is actually related to baby crying so many times, which is like not really true most of the times. Sometimes the babies might be having some associated reflux, some lactose intolerance or cow milk protein allergy. So generally if any baby is having colic less than 1 month, we might actually consider about this lactose intolerance or cow milk protein allergy. When we suspect that, then in some cases we might tell the mother to actually avoid dairy products, soy, and then dry fruits. Otherwise, maternal diet is actually not influencing infantile colic. And nowadays actually probiotics have some role in actually treating the infantile colic, but it's actually not 100%. Most of the times it is actually benign and parents should be reassured that it goes off on its own. And usually this colic is quite common in babies less than 4 months, and most of the times they outgrow it on their own. Only thing is, whenever baby is crying that way, do all the comfort measures. If still in doubt, show to a pediatrician so they check the baby completely. If everything is normal, then we can reassure. So most of the times it's a self-limiting conditions, and parents should not get anxious or be in distress regarding this infantile colic. Thank you.